really, what is public health? So public health is the helping to improve or to continue to have the healthy lifestyles in communities, and that is done through health education. We also have that done through the different lifestyle adjustments that can be made from a health educator, or also there is research and data collection for different diseases or injuries that are common in the community. And through that collection of information and with the education, we're able to complete what is called primary care. So public health really focuses on primary care for the patient or the community members. Primary care is one of the three types that we have in health education. There's primary care, secondary care, and tertiary care. So really with public health, the main one we want to focus on is primary care because it's the easiest. So it's easier to prevent than to treat later on. So with public education, that's why we have the health education. There's different areas that are accessible, filled with information to ensure that people in a community have the best information possible to prevent any type of injury or any type of disease, illness later on in life. That said, a health educator is one who helps implement some of the change that would go on in a community. With that, they are one who obviously has a degree. They're certified, whether through the NCHEC, and they're able to implement change through promoting wellness, teaching healthy behaviors, and collecting the data, as I said before. And so really, they're going to survey the community, figure out what changes need to be made. So say there's a food desert. I know it's a common problem down in Athens, Ohio, food deserts, or in really a lot of poor regions. People cannot get to a good grocery store. Really, there's only convenience stores. So maybe with that, a health educator would step in along with different members of the community, key stakeholders, and public officials, and they would really be able to implement some change by getting together, getting a grocery store together, having the health information they need for the different types of food that would help decrease any illnesses, stuff like that. With health educators as well, they're really meant for a guide. So they're not going to tell a community what they need to do. They're going to let them know of the changes that need to be made. And it's really driven from the grassroots. It's people who really want the change. Because if the health educator comes in and they're not from that area and they're telling all of the citizens what that they should be doing, the change really isn't going to be made. So a health educator is more of a guide to help with the public health implementation of healthy lifestyle change, implementation of policies, and surveying and collecting data to ensure that there is more improvement so that people's lives would be improved and better as a result.